If we look in the future, I think that we and others, we are setting up broader gene panels that we can assess the most important genes to look at mutations that are important for prognostication or prediction. Then we would like to develop tests where we can combine both gene mutation data, the IDH mutation status, and some other layers of information. And it seems like in the near future, this type of assays will be possible to introduce into clinical diagnostics, which would simplify the diagnostic procedure, that you do one test to get different layers of information that is important for prognostic purposes. But then my personal belief is that we should really also consider to do whole genome sequencing, because whole genome sequencing has the potential to cover the different type of genetic aberrations that we want to detect. You will see copy number aberrations, single nucleotide variants, insertions, deletions, but also structure variation, and that could be, or I think it is very important to use whole genome sequencing, for instance, to detect genomic complexity. So I think that whole genome sequencing really has the potential to capture all these different type of aberrations, and even though it's early days, we are planning now within the European Research Initiative on CLL, the ERIC group, to start with a standardization and harmonization procedure to do clinical whole genome sequencing in CLL. It will not be tomorrow, perhaps in a few years, but we think it has such strong potential that it's worth already now starting the procedure.